Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. As pharmacy informaticists, we all know the benefits of e-prescribing. The most obvious one is that we eliminate the handwriting illegibility issues. So it's always been one of our main problems as pharmacists and pharmacy interns and technicians to try and read our handwritten prescriptions that we receive. And we know that a lot of med errors have occurred in the past because of illegibility of handwriting from the prescriber. So e-prescribing really tackles this issue and eliminates the problem with having to read handwritten prescriptions. And the other benefits, as we know, is once you do e-prescribing, then whoever's writing the prescription, they're actually picking drugs off of a list. So if you have a good, clean, computerized drug database, then you can have a good list of drugs that the prescriber can pick. It's obvious which one should be chosen. And that really helps, again, with medication safety. And what's implied here is clinical decision support. So once you have the eyes of the prescriber and they're picking a medication off the list, and assuming they have patient information stored on their electronic health records, and they're using that system for prescribing, then the system can do both passive and active CDSS. So as we've studied in the past, you can have things like tall man lettering to eliminate the issue of look-alike, sound-alike drugs and help the prescriber pick the right medication. You can also apply checks up front to the prescription, and this would include checking for allergies and drug-drug interactions, assuming that all of this is documented on the prescriber's electronic health record. And then also, when it comes to formularies, drug formularies, and picking medications for the patient that might be on their insurance plans, and again, this kind of decision support can help in that situation. So e-prescribing has a lot of values, and I was very excited to see the September issue of the California State Board of Pharmacy newsletter called The Script. Now, The Script in September 2021 had a couple of items that were interesting for the pharmacy informaticists. And so what I'd like to do is bring up a picture of that newsletter and talk a little bit about it. Now, I think that every pharmacist, pharmacy intern, and pharmacy technician should be involved with subscribing to the newsletter for the State Board of Pharmacy if you're practicing in California. Okay. Let me get this focused on getting this presentation started. All right. So pharmacy informatics, and there is an e-prescribing law that's going into effect in January of 2022. So as I mentioned, here is the newsletter, The Script, and you'll see here that the cover story is e-prescribing law that takes effect January 1st, 2022 in California. Now, if you read further down on the index here, you see that they also talk about automated drug delivery systems. Okay, so this would include machines that are used within the pharmacy for inventory control, and also some of the patient-facing technologies, such as the prescription kiosk, where prescriptions are made available to the patient through a machine, through an automated drug delivery system. And it talks about how we accomplish counseling of the patient and dispensing of the medication in a lawful manner through these kiosks. But the main story here, and what I want to focus on today, is the e-prescribing law that takes place, goes into effect in a few months in January 1st, 2022. Can you believe the year's almost over and we're already looking at the next year, 2022? So here it is. These are the main points, the key points from this new law, okay? And basically what is said here is that all practitioners who can write prescriptions, all legal prescribers, have to have the capability of sending prescriptions electronically, okay? Writing and sending them electronically. And every pharmacy has to have the ability to receive this electronic prescription, this e-prescribing event on their system, okay? And the third point here is with every law, there's always exceptions. So just keep in mind that as pharmacy informaticists, we know that we're going to have system downtime, we have network issues, we have software issues, hardware, a lot of expected maintenance. So there's anticipated downtime. Sometimes there's unanticipated downtime. So the Board of Pharmacy realizes this and says, well, if your systems are down, yeah, you can have a written prescription. But as long as the systems are up and working, then all prescriptions should be sent through ePrescribing. Now, I encourage everyone, as I said, to go to the California State Board of Pharmacy website if you practice in the state of California, and get on their email list for alerts. And that would include the release of issues of the script. So you can keep up on what's happening in the state and what's happening with regulations that are being put out by the State Board of Pharmacy. And again, for the pharmacy informaticists, this is a very important issue. I would definitely take a look at script from September of 2021 and take a look at the FAQs that they have available that talk about this new law for e-prescribing and what some of the exceptions are and what people are asking in terms of implementation of the new law. So you can get up to speed on that. But very exciting for the pharmacy informaticists to see that there is going to be a law in place saying that, all right, from January 2022 going forward, we need to stop with handwritten prescriptions and go to e-prescribing, okay? As experts in this area, we'll be able to help implement this law and make sure and monitor our systems, build the databases properly, make sure that our clinical decision support systems are maintained properly to help the prescriber do safe and effective and accurate prescribing. And also on the pharmacy side where we fill the prescriptions, again, we have that clinical decision support, warnings that pop up, and we will have a better time and a safer time filling prescriptions because we'll receive them electronically. We won't have to worry about handwriting issues. And the patient will benefit in the long run from e-prescribing. We will have safer and more effective prescription filling. And that really is our goal. So if this was interesting for you, I would say please like the video and subscribe to my channel. I do encourage you to go to the State Board of Pharmacy for California or wherever you practice and get on their newsletter notification list so that you can keep up with what's happening in your state as far as pharmacy practice and pharmacy informatics items that might pop up, okay? In the meantime, stay safe, stay healthy, look after the health of others. I'll continue to work on more episodes and I hope to see you next time. Take care.